I'm definitely not psychic. But the odds are you're reading this because you're interested in discovering more about the diabetes report. Well, congratulations. This is definitely the diabetes channel you've been looking for. Why? Simple. We'll give you an ongoing supply of essential news, must-have resources, and 100% free reports about diabetes. So go ahead and join our friendly diabetes YouTube channel by clicking the subscribe button now. So now let's watch the video. 3 reasons for the incidence of diabetes during pregnancy. The main problem with diabetes is that there is a lack of proper metabolism. As diabetes is a disease where there is a lack of insulin and glucose metabolism, it is hard to maintain a proper blood glucose level. As diabetes is hereditary, this is another problem that can be passed on to the next generation. However, there is another type of diabetes where there is the lack of insulin and glucose metabolism, and this is the gestational diabetes. As diabetes is caused by the poor metabolism of glucose, it is hard for the body to cope up with this in the long term. It can damage the nerves and the kidney, and as this can occur during the pregnancy, it can lead to the mother developing diabetes. As diabetes can be inherited and gestational diabetes can be inherited, it is wise for parents to avoid diabetes. Mothers can also prevent the occurrence of diabetes in the baby by properly taking care of the baby during the pregnancy. Mothers should eat a balanced diet and also get enough sleep. Mothers should also avoid smoking during pregnancy. As diabetes can also be caused by an illness or stress, it is also good to get medical help when needed. As such, pregnant women should follow these tips to prevent the occurrence of diabetes during the pregnancy. 1. Get plenty of exercise. Exercise helps in the metabolism of glucose, and it helps in the control of blood sugar level. As the glucose level is processed by the muscles, it reduces the risk of the occurrence of diabetes. As a result, the level of blood sugar is also reduced. As the muscles needs lots of glucose, it is a good idea to take supplements that are natural. 2. Eat a balanced diet. As the body needs protein that is required for the maintenance of fetal growth. Likewise, the muscles also need potassium that is taken in the consumption of a balanced diet that is rich in protein. As the muscles depend on the potassium, it is a good idea to consume fruit juices and vegetable juices, which help in maintaining the level of blood glucose. 3. Limit the intake of simple sugars. As simple sugars are easily converted into glucose, they are not good for the occurrence of diabetes. Thus, it is important to limit the intake of these. 4. Monitor the level of blood glucose regularly. As the glucose levels are high, if the frequency of monitoring is not done, it helps the parents to maintain the level of blood sugar. 5. Control the level of blood sugar. As there is a tendency of the child to raise the level of blood sugar if he feels that he is not monitored frequently, it is important to take the proper precautions during the first trimester.